Hello, and welcome back to ASD A New Perspective, the podcast show where we help you understand what is going on in the mind of your child, and we encourage you that growth for your child is possible. And thanks for joining us for our new series, Why Does My Child Need Dynamic Intelligence? As I visited with Dr. Gutstein, I told him that I want my child to be treated as an individual. He agreed and talked to parents about the needs their individual child has.
So I would tell any parent that if you want to really, the treatments that have been developed up to this point don't address what we know from years of research are the problems that prevent people from ASD to having success. They may sound good, but they don't, when you read the research, they don't correlate with those things. And what we've done is we very specifically created a match between the things that people with ASD are going to need to be successful and the things we start to work on from a very early age to make sure that they are able to do those things and are able to have success and don't have to go through life handicapped. So that's what I would say to someone starting, is that this is the way treatment should be conducted. It should be based on what those people need, right, to be successful.
I think one of the things that is so amazing is that this all starts so young in development of us as little humans. And I think parents might not, as you know, I have a daughter who developed typically and a son who did not. And so with her, it just kind of was happening. But, I wasn't thinking about what was happening. Right. And I think that's part of the reason it's hard to realize all that you just talked about started in her almost from the beginning.
If I look at my 2-year-old grandson, he's already doing he's self-communicating, he's self-regulating, he's planning, he's considering goals. He's, starting to make decisions. He's already starting to do these things at a rudimentary level. He's using his imagination effectively. And so, the research shows you have to start as early as possible in these things. These are not later things you do. And when you miss out on them earlier, you have to do them later, and it just more and more things. And then you have to undo a lot of things as well. And the other thing the research shows is how important parents are as guides, not necessarily directing this or instructing all the time, but guiding, making sure the child has an environment where they can grow, making sure that they have the right materials, and making sure that your involvement is at the right level to facilitate what they're doing. Also building the motivation for them. One of the things that gets lost in the autism literature is the importance of intrinsic motivation. And there's been such an emphasis on external motivation, reinforcers, and operants that what happens is you start to see that children who may have a bunch of little discrete skills, but they don't have any of the motivations to sustain lifelong learning, growth, development, mastery, and expanding their world. And one of the things we've had to emphasize is the first thing we do is we build those intrinsic motivations. We build that desire that's there. We make sure it gets activated. We make sure that all of our children are engaging with us because they're very motivated to do so. We don't have to use rewards or reinforcers. We know how to develop those intrinsic desire for relatedness, for personal agency, being able to have more and more influence in your world, for seeking growth, for challenge and mastery, for autonomy. Those are the critical things that have to be developed along with, abilities. And, and also habits too. The habit of stopping to reflect and learn from your experience, habits of thinking before you're acting. There's a number of habits that have to become automatic along with motivation and along with mental abilities that we call mental tools. And it starts early. You're absolutely right. The earlier we can, and our program is nice because it is based on that we can assess each individual's readiness and build from there. whatever the next step is for that person, we start with very basic foundations if needed, and we can go all the way up to very complex functioning. So when a new child comes in, a new family comes in, we can assess and determine where we need to begin. And what that means too is that we can provide this service, we can provide dynamic intelligence program for children with a variety of issues or with no diagnosis at all for enrichment. It's not just for children with autism, although they were the inspiration for this. What we have found is that, these abilities aren't taught to any children. They're just expected to have them. And many children who don't have autism aren't very good at some of these either. And it hurts them, it handicaps them in their life. And so if you're a parent who wants to give your child the best head start, the best preparation for success, I think this program can have a lot of benefit for you to teach you how to do what we call a mindful guide.
I think it's hard when parents are getting these diagnoses at 2 and 3 years old, because they become very vulnerable to a quick fix because of the fear of the future. And I think sometimes what they're seeing kind of on the outside of their child is not what they're not doing right. There's not really what's important. In other words, they're seeing their children might not be speaking yet or something like that.
Yeah, and the problem is with the people who offer those things, they're not they're underestimating these children. Most of these children are going to speak anyway. Almost all of them will. And so it looks like you're a miracle worker when your quote unquote therapy leads to them speaking. And they're not even offering these higher level abilities or the foundations for them, because it's on some level they don't believe they can have them or they can do them. So they're sort of selling it very low, and they're training parents without even knowing it to accept very little for their children. And we want them to think big, and we want our parents to think, we want to raise that bar and say, look, my child can have all that. They can be successful in the real world, not in the quote unquote autism world. And we're going to prepare them for that. And we're not going to, accept what people are trying to sell us, which is this very low level, right, of functioning that they're working on.
I always say we will certainly rise to the low bar if we set the low bar.
Exactly.
That's where we will go.
Exactly. And that's what these early intervention programs so often set such a low bar for the types of things that they're developing. The other thing they do is they don't look at the developmental readiness of each child and say, what is the next step for this particular child? They're sort of very programmatic. Everybody gets the same thing, whether they need it or not, whether they're ready for it or not. And it's very much an assembly line type of intervention, which I think is not, medically, that goes against everything I've been trained to do. To me, you have to individualize based on that person's what they're coming to you with, what abilities they have, what developmental foundations are in place, and you're then looking for what the next step is for that person, and you personalize your intervention. And these treatments don't do that. They're manuals, and you just, when somebody comes in the door, they just get the manual, whatever it is. And I think that's really bad treatment.
Well, as a mom, I want my baby to be an individual.
Yeah, of course. You want your child to be treated like a person, and you want to know that their needs are being met, not that they're being treated like some member of a large group who are all the same somehow.
And thanks for joining us for ASD, A New Perspective, the podcast show where we help you understand what is going on in the mind of your child. And we encourage you that growth for your child is possible. I'm Kat Lee. See you next time.